Hello, my wellbeing buddies. It's me, Steve, the mental health nurse, and we're now going to look at OCD, Obsessive-Compulsive Disorder. Now, I know I've heard this term battered around time and time again, all women at OCD. And the reality is OCD is a real common mental health disorder. And therefore, a better understanding is needed, and we must avoid batting this term around inappropriately because it does undermine the real struggle that people have with OCD. When I've worked in primary healthcare, I had a lot of patients come to me about OCD, and we looked at lots of strategies to help manage this. Because again, having those obsessive and compulsive thoughts and thinkings and behaviors can be exhausting for people. So having a good set of strategies is where you need to be. Equally, I'm aware that primary and secondary healthcare is pretty busy at the moment. So if you do believe that you have OCD, we're going to run through this. We're going to look at some of the risks associated with this. You might hear some of those there. We'll look at how it's assessed. We'll look at some of the treatment, and then we'll look at the medication piece. But hopefully what you'll get from this is a really clear understanding about what OCD is and some of the things you can do to help. So let's start at the top. What is OCD? So OCD stands for Obsessive Compulsive Disorder. It absolutely is a mental health disorder, and it's characterized by intrusive and unwanted, persistent thoughts, images, or impulses. So obsessions. And an example of that might be you can't leave the house unless you've got rituals. You have to tap the door 15 times and double check the cooker's off 4 times, and you've got rituals. And that really does cause distress and anxiety because it's that overthinking, overfear, and the body releasing all of this stress. So those obsessions often lead to repetitive behaviors or mental health problems around compulsion. And again here, what we need to be looking at are attempts to reduce or distress anxiety caused by those obsessions. So common obsessions include thoughts about harm. It could be thoughts about self-harm. It could be thoughts around suicidal ideation or unwanted sexual thoughts. So if you have lots of sexual thoughts, that can be part to do with the OCD. And I have met quite a few patients in my time who have openly disclosed some of their sexual thoughts. And it's where those sexual thoughts go and how they lead which becomes a problem. Now, ultimately, I want us to be very clear. Having intrusive thoughts is not illegal. Acting on them, though, is. So it's not uncommon to have unwanted, horrific sexual thoughts going on up there if you suffer with this type of condition. Just be mindful. You want to have a clear, open dialogue with your doctor or your psychiatrist, and you want to look at managing those risks. Equally, we see it on the opposite side with common compulsions that involve things around cleaning, checking, counting, or saying particular phrases and actions. Ultimately, OCD can be quite a debilitating disorder. So it really does interfere with daily life. It can interfere with relationships. It can interfere with work. And ultimately, a lot around the stigma, so the shame, the embarrassment, and the guilt. So let's look at some of the risks associated with OCD. And this is really important because, again, if you have this or if you feel that there's these tendencies here, understanding those risks and getting help is really important. So because of the risks associated with this and because of the impact on life, it can obviously cause impaired functioning. Because if all you've got are unwanted and intrusive thoughts running around your head, you're not present in the now. You're not concentrating, you can't focus, and you can't take in what's being said. So it can have a real problem with impaired functioning. So that's our working executive memory part of the front of our brain. It's obviously going to cause anxiety and depression. If you've got negative thoughts and feelings going around in your head all day long, it is going to be draining. It is going to make you feel much more at risk than others. So again, managing that, making sure that anxiety and that depression piece is being treated is going to be really important. People then are at risk of social isolation. So if you've got these thoughts, or you don't feel safe, or you can't leave the house because of this behavior, that's going to cause social isolation. People with OCD are more at risk for suicidal ideation and self-harm, because it's those negative thoughts, that constant whirling going around, and unable to turn it off. And then finally, self-medicating. So people with OCD tend to turn to drugs and alcohol as a coping strategy. The problem with that is it then leads to addiction, and then that leads to health complications. So nipping this in the bud is exactly where you want to be. So how is then it assessed? So as per always, we have the DSM-5, which is the American psychiatry system, and we have our ICD-11, which is how we assess in the UK. Either come up with the same thing here. So OCDs can be assessed using the diagnostic manual, the DSM-5 or ICD-11. The diagnostic tools by mental health professionals look at different things here, and there's a list of criteria in which you need to look at, and that is about, does it impair your daily functioning? Is it causing significant stress? And do those thoughts represent themselves? Do they show urges? Can you have images? And again, you get a number of criteria on that. So ultimately then, how is it treated? So there are non-medical ways of treating this and medical ways of treating this. So non-medical ways is going to be CBT, cognitive behavior therapy. And that's that talking therapy to understand thoughts turns into feelings, and those feelings then turn into a behavior. So ultimately, if we can manage those at the thoughts point, we stop some of that cycling. Equally, they might do exposure response therapy, and that's where they try to expose you to what's going on, and gradual exposure to get you used to what's going on to help manage those thoughts and feelings. There may be other things there that can be done to help. So mindfulness, grounding skills, relaxation, guided meditation, visualization, progressive muscle relaxation, positive self-talking, acceptance and commitment. So there's loads of things that we can do to help manage those thoughts and feelings. Equally, you may then want to think about, have I got the anxiety and depression piece? So you could be looking then at multivitamins, such as a high dose of vitamin D. You might want a high dose of vitamin B6 to help manage the mood and anxiety. And again, you might want to look at some PRN medication, so as and when required for anxieties, like rescue remedies or sprays. Or alternatively, there's that piece around sleep, because if you're laying in bed and your head's spinning, look at my insomnia video. Or alternatively, you might want to do some NITOL or something there around, just to manage those nights where you're spiraling and thinking. If that's not working, the good news is you can go to your doctor. You don't need to wait to be referred to secondary healthcare here. So go to your doctor, explain the fact that this is causing the depression, the anxiety side, because sertraline and escitalopram, the normal 2 SSRIs, so that's those selective serotonin inhibitor uptakers, used to treat anxiety and depression, are also used for OCD. And what you will find is, by taking that dose, hopefully that will improve the symptoms. Normally, if you're on sertraline, you'll be starting on a 50-milligram dose. That will then probably be assessed in a couple of weeks. Just be mindful about taking SSRIs in the first couple of weeks. It can cause a bit more overthinking. It does increase the risk of that suicidal ideation. So make sure that you're well, you've got a crisis plan and safety plan in place, and you'll be managed through that piece. And then what you might find is that the dose is put up a little bit to maybe 100, 150, depending. I would expect you to be on that for about 6 months. But what you want to happen during that period, you want to be referred to the IAP services. So that's the intensive psychological therapy, which is all across the United Kingdom. And if you're not in the United Kingdom, look for your registered therapists that do CBT. And then you can register with those, and start that piece of work around understanding the cognition. So why is it you're doing what you're doing? Is it a coping strategy? Is it a sign of trauma? Where did this come from? If you can manage that, you've then got your cognitive behavior stuff bringing your mind down. You've got the medication keeping you safe. And then at the 6-month mark, you can look at kind of a reduction program. And then hopefully you will find your coping strategies and that medication working really well. Don't forget, you can't just stop SSRIs. That's really dangerous. It will cause relapse, and we don't want you to go there. So just a summary then, what is OCD? OCD is indeed an obsessive-compulsive disorder. In other words, you're having thoughts, feelings that you can't stop, or behaviours and actions. The risks here are quite intense. So we're looking around risks of suicidal ideation, self-harm, increased behaviour, breakdown in relationships. How is it assessed? The DSM-5 and the ICD-11 criteria. It's about the intensity, the frequency, and if it's affecting your life on a day-to-day basis and relationships. What is the treatment? Cognitive behaviour therapy and all of those coping skills that we've done in other videos, such as grounding, mindfulness, etc. And then finally, medication-wise, if you need something prescribed by a doctor, you're probably going to be looking at selective serotonin inhibitor uptakes, sertraline, or escitalopram. Anyway, I hope you liked this video. If you did, please make sure you subscribe, ring the bell, do all of those bits and pieces that you need to do. I'm Steve, take care, and I'll see you in another video. Bye for now.